So let's talk about some drugs. This is part two of things I wish I knew before starting my AA program. Every single time you're introduced to a new drug in class that you think will be applicable to what we're going to do, so whether it be an antibiotic, an induction agent, a paralytic, make sure you immediately have a flashcard made of that drug consisting of the brand name, the generic name, the onset, duration, the peak, the mechanism behind the drug. Until you know exactly what a drug does and how it does that, you should never give it. On top of that, you're also going to need to know the concentration that it comes with in the vial that you'll be drawing it up. You then need to know typical dose ranges of that drug and how to calculate the exact amount that you would need based on the weight of the patient. Let's say for propofol, it's 1 to 2.5 milligrams per kilogram. On top of that, you also need to know how to quickly calculate how many cc's or milliliters of a drug you're going to need for the exact amount of drug that you will be giving. So, like phenylephrine comes in a vial that's 10 milligrams per milliliter. You need to know how to dilute that down to 100 mics per milliliter because the dosage range is usually 100 to 200 mics. So, knowing all of the drugs and the dosages and everything about them is going to be vital, and you need to get that down ASAP. One more thing is a little side note. Know what could go wrong with that drug and know how to fix it. So sticking with phenylephrine, if I give that, it's just going to act on the alpha 1 receptors, which is going to cause an increase in blood pressure. However, it also causes reflex bradycardia. Therefore, I should kind of judge where my patient is already at and see what their heart rate's at, whether I want it to drop any further. And if I feel like it's okay to administer the drug, I need to watch that heart rate and make sure it doesn't go below what I feel comfortable with. And if the heart rate does drop to a point where I think the patient's safety is in jeopardy, then I need to know how to fix that. I need to give a drug that will then fix what I just did. Also, know the way that your drug is metabolized, whether it be the liver, renal system, and there are going to be some oddballs out there, such as cisatracurium with Hoffman elimination or remifentanil with plasma esterases. So know your drugs, people. The patient does not have the luxury of you fumbling around, not knowing what you're doing.